Hi everybody, I'm Kelly Close with HealthyPlace.com. Today we're going to be talking about self-harm recovery. First we'll talk to a young woman who has been in recovery for 2 months, and then we'll speak to Dr. Norwood, who will give us some ideas on how to stop self-harming behaviors. Be sure to ask your questions and share your experiences in the box as we go along, and we'll integrate them into the conversation. So first, I'd like to bring on Hadley Grace. She's a 21-year-old student. She's in recovery from self-injury, and it's been 2 months since she last self-harmed. So let me bring Hadley on. Did I do it? Oh, here we go. Hi, Hadley.
Hi.
How are you doing today?
I'm good. How are you?
I'm good. You said before that you first self-harmed at 12, and then there was a long time in between, and the self-harm started again when you were 19. So can you tell me a little bit about what was going on? Because you mentioned that you were hospitalized too. So what was going on that caused that crisis?
So when I was 12, there was a lot of things going on in my home life, but the main thing that caused it when I was 19 was school and a lot of pressures that I was both putting on myself and that were external, and just a lot of things that were going on. And I was also starting to work through some trauma while I was in counseling, and it just wasn't the right time for that. I wasn't ready for it, and so it kind of overwhelmed me. So I was 19, I was a sophomore in college. I'm a senior now, and so I was a sophomore then, and I started self-harming. It was November, in the middle of the semester, and it was a really scary time because things escalated really quickly. I ended up going to the hospital because I was both, the self-harm was escalating, and also I was having suicidal thoughts. And so they decided that the best thing to do would be for me to go inpatient at a mental hospital.
I see. Well, so it's been 2 months since you entered this phase of recovery. How many times, or has it been the longest time you've been in recovery from self-harm?
About 2 months is the longest I've gone. I went 2 months before, a little while back this year. And then again, just recently hit 2 months again. So I'm really proud of that. But that's the longest I've gone since it started back in 2018.
Okay. How many times do you feel like you've tried to recover between now and then?
Oh, constantly. It's been a constant fight to stop. It's like every time I self-injure, I want to stop like immediately afterwards. I get really motivated and I want to stop doing it, and a few days will go by and then I'll get into like another depressive state and get emotional and overwhelmed, and that will become something that's really difficult to deal with. And so it's taken a lot of work and a lot of time to figure out what works for me in terms of coping in a healthier way.
So think back, to like one of the first times you were recovering from self-injury. What would be the biggest challenge to you in those initial periods?
The biggest challenge was probably just my hesitancy to talk about it with people. It was really difficult to reach out when I was struggling, just because I felt like I was a burden and like I didn't deserve help, because I was just falling down again, and someone had to help me back up every single time. So that was really difficult. And what I learned is that it's always okay to ask for help. It's always good to have like a variety of people you can go to, whether that's your therapist or a crisis hotline or text line, or different amounts of friends that you have that you can trust and that are able to cope with it and able to help you through that.
Well, how does a crisis hotline help you? Just briefly, what have you gotten from like the free numbers out there?
So I usually use the crisis text line, which is 741-741. You text home to that number. I like it because it's usually a really fast response, even if it's like a Friday night or some other time, like a weekend that's more difficult for me. Um, and what I've gotten is just the ability to vent my emotions, um, and be able to have someone like even if they don't understand, like be able to um, like be present for that, um, and be able to like offer some tips to cope, even if I know the tips already. It's helpful for someone to direct me towards that.
So their suggestions, do you feel like it brings you back to center a little bit? Or
Yeah, it helps me like refocus on what is really like my options, because when I want to self harm, usually it feels like the only option that I have, and for someone to like physically or like just verbally or written down tell me like here's what you can do, um, that's really helpful for me. And another thing that helps in the same vein is writing stuff down myself. So having like a self care menu is something that one of my art therapists told me to do a while back. And so I made a self care menu, and I've revised it a few times, and I have different ones for different situations, whether I'm at school or at home. And overall, it's just easier to choose self care and to love yourself rather than to hurt yourself whenever you have something tangible in front of you telling you how to do that.
that makes sense. We have a question from DB23. What things have hurt or undermined your self-harm recovery?
That's a good question. I think um, I had a therapist, my old therapist. You have to be really careful when you choose your therapist and when you are deciding on a therapist, because while I did have a pretty good relationship with this therapist, he didn't always treat self-harm with like the amount of severity that I needed to. Not that that he needed to be harsh with me, but that he needed to treat it more with more concern, a little bit more more concern than he was doing so at the time. So my new therapist that I have now is really good with that. So that was one thing. I got like a little too much grace basically whenever it happened, and didn't really have anyone telling me, hey, you really need to stop doing this because it's not good for you. So I needed more accountability.
Well, that makes sense too. Now, as far as, is there anything else that's kind of taken the wind out of your sails? Have you gone to somebody
Yeah.
and
Yeah. Some really discouraging things, whether it's like situational, whether it's like external from me. But the main thing is when it happens again, or when someone, like a friend, doesn't really know how to handle it and doesn't really treat it with the kind of compassion that is needed in that kind of situation. That they don't have like the right boundaries or the right self care for themselves. So that can be really difficult. Um, and that kind of like brings me down when someone doesn't really know how to help me, or I feel like a burden to someone.
has someone made you feel that way?
Yeah, it's happened a couple of times with some close friends who aren't as close anymore, but I also have found that having secure people who I know I can go to, like I have a friend who doesn't live in the same state as me, but still is there when I need her, and I have my therapist who, if I need to vent, I can send an email to or leave a message on her phone, and she can get back to me later. She doesn't answer right away. So really, it's really difficult when I come face to face with it, with someone who doesn't know how to handle it, basically. But it's possible to find people who do know how to handle it and do know how to help you through those moments and help you through the bigger moment, the season of recovery,
Mm-hmm.
wherever stage you are with that.
We have Victoria, pardon me. Victoria wants to know if you have support from your family and how has that affected your recovery effort?
I do have support from my family, which has been incredible, and I'm so grateful for it, because I do have people in my life who didn't have support from their families, and that was really detrimental for them. And so when my parents found out, they were obviously like really concerned and really scared at first, and that was really like frustrating for me because I just wanted the support. They did eventually were able to get there to a point where they were able to support me in a way that I needed, with the compassion and the physical acts of like taking sharp objects out of my reach, basically, things like that. And so it was incredibly difficult to go to my parents and talk to my siblings about it. But I'm really grateful that I did, because I wouldn't be in the stage of recovery I am in now if it wasn't for my family.
So do you find that there was a learning curve for your family there?
Oh yeah, definitely. And I feel like there's always going to be like a learning curve for family members when you come to them with either a struggle or something new that's different from your family, whether it's saying that, oh, I am struggling with self harm or with an eating disorder or something like that, or even if you're like coming out as LGBTQ plus, that can be a big change for them and a big learning curve as to how to react to that, because it's a different expectation than the one that they had for their child, and so it's difficult. So you have to be aware of that, and it's easy to get like angry and frustrated. Um, and so if you're worried about it, I recommend, if you have a therapist, if you don't have a therapist, I would recommend getting a therapist and then having your therapist be involved in that conversation, so someone is on your side and can explain it a little bit better than maybe you can.
If I'm so glad you have a therapist. You know,
Yeah.
that's wonderful. And a lot of people, they don't. So what would be the next best thing to have it to telling your therapist what's going on?
The next best thing is telling the people closest to you, whether that is your family who is like in like physical proximity to you if you're living at home, because I know that definitely a lot of young, like me, like a lot of young people struggle with self-harm especially. And so telling family members, especially your parents, can be a big help. And they can help you get the help that you need. If that's therapy, if that's like group therapy, if that's even going to the hospital if it's reached that point. Um, Parents can be a huge support. However, there are parents who may not be as supportive, who may not know how to deal with that. Um, so I would recommend going through an organization like HealthyPlace or To Write Love on Her Arms, who has a find help site on their website,
Mm-hmm.
where you can find affordable help, people who specialize with adolescents or specialize with whatever age group you're in, who know how to handle it. And also, when you're in a crisis, it's helpful to reach out to those helplines,
Mm-hmm.
my crisis text line or the National Suicide Prevention Hotline, when you are in an immediate crisis.
We have a comment from Recovery is Hard. They say, I self-harm. I find it very demoralizing every time I relapse from trying to stop, and I
Mm,
feel like giving up during those times. Can you identify with that?
definitely. There have been so many times. Like I have always been like fighting for recovery, but there have been like weeks where I'm just like, I don't even care anymore. I feel like I can't stop. I feel like there's no point in trying to stop. And what would help me in those moments is learning the stories of other people who have struggled with self harm. So, reading blogs or talking to my friends who have struggled with it. Something like this, where someone is a little bit, even just like a little bit further ahead than I am, to be able to like take my hand and say, you can make it. You can make it through this moment, through this hour, through this day, through this week, and gradually it becomes more and more possible. It's just, I have this message, this affirmation on my whiteboard that says 1 day, 1 hour, 1 moment at a time, because that's really what it's about. It's not about like this big long term, like I'm going to be 10 years removed from self harm. It's like, hopefully, yes, one day you will be. But in order to get to that 10 years, you have to go 10 minutes or ten breaths without doing it. And that's possible. It becomes more possible every moment, every time you decide not to.
I'd like to take just a second to mention that you can find a lot of information about self-harm on the healthyplace.com
Mm-hmm.
website. And there are stories on there of people, about their self-harm experience and a blog from people who have self-harmed and who are in recovery. So I just wanted to mention that.
Yeah. And resources like that have been really helpful for me. Like anytime someone can say, hey, I went a few weeks without self-harming, and that's just really hopeful for me. So resources like that are so important.
Well, Hadley, I thank you so much for being on here today and sharing
Yeah.
your coping mechanisms with us. And I know you're helping a lot of people out there.
Thanks.
So again, thanks. And I'm going to bring on Dr. Norwood, and you might want to listen to her too.
All right.
Thank you.
Great. Thanks.
Now, let me see. I'm looking for, there she is. Let me see here. Okay. Dr. Norwood, she's a licensed clinical psychologist, and she's worked with military veterans. Hi, Dr. Norwood.
Hello.
You've worked with military veterans and most recently college students, and you're hoping to remove stigma from mental illnesses and the behaviors mental illness can cause, such as self-harm. So we appreciate that, and thank you for doing that. Did anything strike you in particular about Hadley's story?
Yeah, I think, are you able to hear me okay?
Maybe down a little bit. Can you move it down a little bit? Yes.
Better?
Yes.
How's that? Okay, perfect. We're all adjusting to virtual forms of communication these days. So thank you for having me here. You know, I think the piece that was really striking about Hadley's, what I will call a journey, is that one, she was able to talk about it. So I think being willing to share that journey, and I think also just talking about the fact that it is a journey, right? It's sort of a process, and it's a moment by moment process. And so, you know, I think that that is really commendable. The other piece that really struck me in what she shared was just the fact that it's so helpful to have people around you that are supportive, that are not going to shame, that are going to sort of not shame you, but sort of support you in the process. And so, you know, I think those pieces were really just sort of striking for me.
Oh, when you work with people, do you find that shame is a big part of their journey?
Absolutely. I find that, you know, a lot of the clients that I work with, it's sort of a double-edged sword in the fact that, you know, there's a lot of shame around the emotions, the internal emotions and experiences that they're having. And then the secondary piece is if I'm utilizing self-harm or self-injurious behavior, such as, you know, self-mutilation or cutting or things of that nature, then there's that secondary shame that comes along with it. So here I am trying to sort of battle both of those pieces. And, you know, the tendency for a lot of the clients that I work with is just to internalize it for fear that people won't understand, or they will continue to make statements that are insensitive, or again, just sort of build that guilt up within me.
Right. Well, when you're working with your clients, and what do you tell them to help them cope or maybe, you know, stop the behaviors?
Yeah. So, you know, one of the big pieces, and I think I bring this into the therapy room in general, if it's self-injury or trauma or things of that nature, is normalizing it, in the sense that it's a way that people have learned to cope. Right. So some people drink alcohol, some people gamble, some people use relationships, and some people self-harm. It's a way that over time, these individuals, these clients in my case, have learned to cope with their emotions. It means that their emotions oftentimes get way too intense. They become really overwhelming, and they need sort of a release of that physical sensation. So, you know, the same way that if any of us were to exercise, we would get, you know, a release of those endorphins. It's the same process, or it's described similarly for individuals who self-harm. So I try to really go into that therapeutic environment, just sort of normalizing that piece for them, which hopefully helps to, one, build rapport, but also bring down that shame and that guilt that you were sort of speaking to and that Hadley talked about as well.
Mm-hmm. Hannah says, I feel a lot of shame because I self-harm. What can I do about it?
Yeah. You know, I think the first thing would be to find someone that you trust to talk about that with. And, you know, so often I hear from my clients, there's no one that I trust with this information because it's so intimate, it's so emotionally charged. And so that's when I think a therapist can be really helpful, because it's someone you're not seeing every day. It's someone you're in sort of a non-judgmental space with. So I think that can be helpful. The other piece, you know, if you're not at that sort of point or don't have individuals in your life who you can connect with on that level, is also doing some of what Hadley described. So what I like to call journaling. So it's a way, again, to talk through the emotions, to release the emotions. So writing down your thoughts, writing down your feelings. We're in this age where we're using so much technology right now. You can make video diaries, right? It's a way that you're allowing yourself, when that urge comes up to self-harm, you're allowing yourself just a moment, because sometimes a moment can stop the train from getting off track. So if I can just take a moment to take a breath in and out, or just take a moment to, you know, go to the refrigerator, right? We call it physical grounding in the psychology world. Go to the refrigerator and grab an ice cube. For that moment in time, I'm going to focus on this cold sensation that that ice cube has in my hand versus taking something to self-harm.
That makes
That's
sense.
a great question.
I really liked something Hadley had said. She said 10 breaths at a time.
Yes.
You know, and do you recommend anything? Can breathing help stop this cycle?
Absolutely. I think breathing can help us all in the midst of everything we're going through right now. And on top of that, I think it can be extremely beneficial for those who are dealing with self-harm and self-injury. And so sort of in practice, what that can look like is just taking a moment to take a breath in and out, right? I will share with you that sometimes the challenges, we try to utilize these skills when we're at our highest levels of stress. So I often will encourage, you know, the clients that I work with and myself as well, to practice those breathing exercises every day. So it's a new skill. You know, if you're training to run a marathon, you're not going to be able to go to the gym if they're open, but you're not going to be able to go to the gym and just, you know, run that length of time. You're going to have to build up to it. So I absolutely recommend focusing on your breath and just being still in the moment. And what that sort of the science behind that, what that teaches us is I don't have to be afraid of my emotions. I can allow myself to get in touch with my emotions. I can connect with them. So when those emotions then become highly charged and I then have that urge to self-harm, I have learned a skill to be able to tolerate my emotions a little bit easier.
Well, we have a comment from Rockin' Rihanna, and she's, I once told someone I self-injured and they were repulsed. It was such a traumatic experience for me that I can't share it with anyone now.
Absolutely. And I think what I would share sort of instantly, what comes to me is, here you are being brave enough on an Instagram live to share that. And so I think that, again, as I said about Hadley, I think that's commendable. And so, you know, I think using that skill that you used in here, that bravery, to find someone that is someone who's trustworthy, right? I think the first piece is admitting that to ourselves, that we self-harm. And then the secondary piece is, can I find someone that I trust enough to then release that information to? It's sort of like if you work and you have had multiple jobs, you're likely to run across a boss that is not the greatest, right? And so if we judge that one boss, that all of our future bosses are going to be the same, then we probably will never work again or choose to only work for ourselves. And so in a similar vein, what I would share with you is that there is probably someone out there. It may be a licensed mental health provider, but there likely is someone out there who can hold that emotion for you without making you feel shame for it.
I like that, who can hold that emotion for you.
Yeah.
Could a stranger hold that emotion? Like if Hadley talked about calling the crisis line, is that the thing that happens with a stranger?
Absolutely. I think the crisis line is a wonderful resource. I know several of my patients have utilized that during times of distress. I also think that some people have family members and friends, or people who are part of faith-based organizations, people in their community who can also hold those emotions as well. Sometimes we prefer to have someone we're connected to be able to hold those, but it does take time. Just like with building trust, it takes some time to figure out if someone can hold that. And I think one of the ways you could approach that is, by sharing with someone that, you hope to be able to hold that, is to say, I have something I would like to share with you. I feel really scared. I feel really uncomfortable. I feel a lot of shame about it. And what would be helpful after I share this information with you is if you did. And then insert what you want from them. It could be just a hug, if, in the midst of COVID-19, if that feels okay. It could be just for them to sit with you while you're feeling tearful. It could just be to sit in silence. But whatever it is that you feel like you need, and sometimes we don't know, but in that moment, whatever you feel like would be helpful after you share that information, then that way they can try to respond in a way that's helpful to you, not in a way that they think is going to be helpful to you.
That makes sense too. Really says, after 8 years of self-injury, I can say I recovered. It's been almost 2 years since I did that. Anxiety medications and DBT therapy helped.
Yes. And those oftentimes, so for some people, they are able to just participate in some kind of therapy. And for some people, the combination of medication management and therapy services together are what helps them in that recovery journey. So I'm so glad to hear that that was helpful for you. I do want to highlight, if it's okay, one thing that she sort of mentioned, which is dialectical behavior therapy. So DBT is what we call it for short. And that is a treatment specifically designed to help with self-injury, to help with suicidal behavior, to help with sort of these high-risk behaviors. It is intensive, it is a lot of work, and yet I have seen personally a tremendous amount of success when people are in a space where they're able to commit to it. So oftentimes it's a combination of learning some of these grounding skills. So breathing, some of the physical grounding skills I talked about earlier, getting in touch with the root of the self-injury. That could be childhood trauma, that could be other events that have transpired that were never really worked through. And then it also builds into that model a chance for you to develop a healthy relationship with someone that does have boundaries on it, but a healthy relationship where when those urges do arise, you have someone that's a safe person that you can connect with and share those experiences and those emotions with, and they can help you in the process. And then the ultimate idea is that you take those skills that you learn, as she was sharing, and you transfer them outside of the therapeutic environment to your everyday existence.
Well, I'd just like to take a minute to remind everybody that HealthyPlace.com has all kinds of information about self-harm on the website, everything from why people self-harm to treatment for it. And I invite you all to go there. And Dr. Norwood, I think you had some resources for us.
Yes. So we talked a little bit, Hadley shared a little bit about the National Suicide Crisis Hotline. So that's a wonderful resource, as well as the 741-741 number. That's kind of a number you can put on your cell phone and sort of plug that in. Two other resources, the National Self-Injury Outreach and Support website really has some wonderful resources. I think, education and awareness is so important. And, this month happens to be Minority Mental Health Month. And so in terms of if there are persons of color who might be interested in finding therapy services that particularly address communities of color, there's a website called Therapy for Black Girls where they have tons of resources designated specifically for communities of color.
Well, that's really helpful. And I appreciate you being here today because you've offered a lot of helpful information for our viewers.
Yes, thank you.
Yeah, and thank you so much. And I hope to talk to you again.
Absolutely. Everyone take care and be safe.
Bye.
Bye-bye.
All right, that's it for our show today. I hope you found something useful in it, and we'll be back next week. But in the meantime, remember, go to HealthyPlace.com. Not only do we have self-harm information and a lot of it, but we have information on all kinds of mental illnesses that can lead to self-harm and personality disorders and all kinds of interesting things there. So thank you for joining us today, and we'll see you next week.